Hi, it's Kaylee, one of the nurses at My Mastery Nursing. Today we're going to talk about another next generation question type, the highlight question. Ready? Let's get to it. Highlight questions on the Next Generation NCLEX are basically the same as SATA questions. I know what you're thinking, happy, happy, joy, joy, right? Still, it's nice that you aren't literally dragging a highlighter. Each choice just highlights when you select it. For example, answer choices could be within a progress note where you select concerning findings, inside a medication record, choosing which medications are due, or on a page of orders, clicking on which ones to clarify. Let's take a closer look at a highlight practice question from the My Mastery app. The nurse assesses a client in the emergency department. Select to highlight the essential information the nurse will present to the charge nurse as evidence the client needs to be placed on airborne isolation precautions. So basically, this question is asking which things indicate that airborne precautions are warranted. It's very important to make sure to read the whole passage carefully before making your choices. A 26-year-old male client presents with chronic productive cough that has recurred after COVID-19 infection 6 weeks ago. Client is a newcomer from Somalia with refugee status. 2 weeks ago, client was started on prednisone and albuterol inhaler PRN for 10 days for treatment of COVID-19 related cough. Client felt better for a few days, after which developed fever, aches, and night sweats. Cough has returned, but COVID-19 rapid antigen tests have been negative. Now, let's see what our choices are. Chronic productive cough that has recurred after COVID-19 infection 6 weeks ago. Newcomer from Somalia with refugee status. Started on prednisone and albuterol inhaler PRN. Developed fever, aches, and night sweats. And COVID-19 rapid antigen tests have been negative. Did you get distracted by the mention of COVID-19? If you read the whole passage carefully before answering, you would know that it's not an active infection and that the tests are negative. The other options, especially when considered together, give the nurse reason to suspect a diagnosis of tuberculosis. The client should be placed in airborne precautions until testing can be done. The highlight question is just presenting information in a way that you would normally see in the clinical setting. These questions help ensure that out of the sea of patient information, the nurse can locate and use the data to make important clinical decisions. If this video was helpful, click the thumbs up and subscribe button and check out the other videos in our Next Generation NCLEX series. Make sure to download the My Mastery app using the link in the video description to get started answering more Next Generation practice questions.